مش عارف ليش متأخر يعني.
أول شيء كل عام وأنتم بخير، رمضان كريم إن شاء الله. بداية المحاضرة راح نكمل عن non-plastic lesions, the bone fractures and osteomyelitis. Fracture is a loss of bone integrity. It could be due to mechanical injury or diminished bone strength. We can classify fractures into different types. For example, simple, when the overlying skin is intact. Compound fracture, if we have opened fracture with overlying skin open. Comminuted, when the bone is fragmented. Displaced, when the ends of bone at fracture site are not aligned together, okay? When we have misalignment. Pathological fractures, when we have a fracture due to weak bone, due to tumor, infection, or other bony disease. A green stick fracture, Hadal type, usually seen in infants, when it's extending only partially through the bone. ما في عندنا full discontinuous fracture, not full discontinuity between the bone fragments. Okay, so this type seen in infants, green stick. Stress fracture, it's a slowly developing fracture associated with increased repetitive physical activity. Okay? Right. Fracture repair, we have stages of fracture repair. First of all, hematoma formation, بصير في influx of blood due to rupture of blood vessels at the site of a fracture. فالblood will fill the cavity and the spaces at the site of a fracture and the bone injury. This clotted blood will give a fibrin meshwork. This fibrin meshwork acts as a scaffolding for the influx of inflammatory cells and the ingrowth of fibroblasts. Okay? So بصير في عندنا fibrin شبكة من الفبرين بيجوا الفايبروبلاست اللي بدهم يعملوا الفبرين deposition and inflammatory cells. Then we have a release of factors اللي هم platelet derived growth factor, transforming growth factor beta, fibroblast growth factor released from the platelets and the inflammatory cells. ايش الفانكشن of these factors to activate the osteoprogenitor cells اللي موجودين بالبريوستيوم, medullary cavity and surrounding soft tissue. فيهم progenitor cells, osteoprogenitor cells, بصير لهم activation من ال factors that are released by the inflammatory cells. At the end of first week بصير في عندنا formation of soft callus. Soft callus عبارة عن unclassified tissue. يكون still unclassified. Soft callus or procallus called. Then, after 2 weeks, the soft callus transformed into bony callus with the deposition of woven bone من ال osteoprogenitor cells. بصيروا يعملوا deposition of woven bone at the end of second week. هلا الcallus when it's subjected to forces, weight-bearing forces, ايش بصير؟ بصير في عندنا process مع الوقت اسمها remodeling. يعني البون الزيادة اللي تكون ايش بصير فيه؟ بتكسر will be removed and the lamellar bone will form. بصير fine bone in a process called remodeling. The healing process is completed with what? With the restoration of the medullary cavity at the end of fracture repair. آخر شيء بصير medullary cavity restoration. Okay? طيب. The second topic اللي هو osteomyelitis. It is inflammation of bone and bone marrow due to infection. It is the primary bone infection, يعني only bone infection. It's much way more common than secondary systemic infection. يعني مش تيجي من systemic infection adjacent to the bone and coming to the bone. Okay? The primary bone infection is more common. Types, we have biogenic bacterial infection, mycobacterial osteomyelitis, and syphilis. But biogenic osteomyelitis, bacterial osteomyelitis, Most common important route of infection with bacterial infection, hematogenous, seen in children, especially in children. It could also be spread from contagious site, adjacent site, or direct implantation after, for example, trauma or bone procedures, orthopedic procedures. But most important one in children اللي هو الهيماتوجينس. In adult ايش هي؟ الراوت الثالث اللي هو direct implantation after compound fractures or orthopedic procedures. This one seen in adult more. Most common organism seen in 90% of positive culture osteomyelitis اللي هو Staphylococcus aureus. يعني عملنا مثلا أخذنا مسحة من الاوستيومايلايتس سايت وعملناها culture. Most common organism was Staphylococcus aureus. In 50% of cases, we will not find a source of infection. Okay? Haemophilus influenza group B streptococci seen in the neonates, اللي هو osteomyelitis in children, neonates. Salmonella seen more in sickle cell disease. هاي معناها انه salmonella more common in sickle cell disease. But sickle cell disease patients ايش more common type of bone infection? The same as the other population, اللي هي Staphylococcus aureus. In fractures and orthopedic procedures, we will see the mixed aerobic and anaerobic infection. And unidentified زي ما حكينا in 50% of cases. ممكن ما يكون في يعني الculture will not find a single microorganism. Most common site with bone that is affected by osteomyelitis هو الميتaphysis. Okay? In infants, it might spread to the epiphysis and joint. Bacterial infection, of course, إيش بيعطينا؟ بيعطينا suppurative inflammation بيكون mixed inflammatory cells, acute first stage بيكونوا neutrophils. It may spread this acute suppurative inflammation to the periosteum اللي هو outer layer, especially in children. ليش in children؟ لأنه بتكون loosely attached to the cortex, periosteum, ف easily can be elevated. Can spread the infection to the periosteum in children. And ايش بصير لما تعمل elevation للperiosteum؟ بصير collection of inflammatory cells. Localized collection هذا بنسميه ايش؟ abscess. Okay? فبصير subperiosteal abscess. With time, we will have destruction to the bone necrosis اللي هو اسمه sequestrum. Okay? بيكون destructed necrotic bony tissue. Then it might rupture into soft tissue or skin, and we will see what a draining sinus. فهدول كلهم manifestation and morphologies of bony infection. ممكن نشوف draining sinus into skin, sequestrum, necrotic bony tissue, subperiosteal abscess formation. More than one week بصير اسمها chronic inflammation أو بصير في عنا influx of chronic inflammatory cells. اللي هم plasma cells and lymphocytes that will secrete cytokines to stimulate resorption of dead bone. اللي هو necrotic bone بصير resorption and resorption اللي هو devitalization and formation of a shell, reactive shell عبارة عن new bone formation. Okay, من deposition of osteoblast بصير اسمهم involucrum. Okay, هذا عبارة عن reactive new bony shell. This chronic abscess can persist while chronic abscess formation Brody's abscess بسموه with a draining sinus. كل هاي اسماء بس لها definitions ممكن تحفظوهم. مثلا هون initial site of infection. This is the outer periosteum. ممكن يصير في عنا periosteal abscess formation with time. Then sequestrum اللي هو عبارة عن necrotic dead bone. Okay. الانفولكرم اللي هو البوني new bone formation after the destruction and resorption of dead bone. هون بالhistology you can see sheets of inflammatory cells. Here it is neutrophils. Okay, this is acute inflammation. Okay. طيب. Presentation ممكن البيشنت يجوا acute systemic illness with fever, with bone pain and leukocytosis, elevation of white blood cells with CBC. In infants, usually the presentation للأوستيوميلايتس unexplained fever. In adult, بيكون في عنا localized pain. بالdiagnosis, the main modality of diagnostic procedures, X-ray will show destructive lytic focus surrounded by a sclerotic rib اللي هو representing the newborn formation. ممكن كمان نعمل culture للبلد والsinus drainage, and that will show the microorganism causing the osteomyelitis. Treatment with antibiotics and surgical drainage if we have abscess formation. The consequences of infection: pathological fracture, okay, bone still weak, can be prone to fractures. Septic arthritis, inflammation of the joint. Bacteremia and septicemia, systemic inflammation. It can source of a systemic illness. Chronic skin sinus increase the risk of squamous cell carcinoma at the site of the sinus formation. And it could be a source of what, or increase the risk of what? Osteosarcoma. These squamous cell carcinoma and osteosarcoma are rare complications, لكن prevented. هاي عن اللي هو tuberculous osteomyelitis. It may follow pulmonary tuberculosis or extrapulmonary TB in 1 to 3% of cases. Usually it is a hematogenous spread through blood to the bone, TB, بصيرها hematogenous spread to the bone, TB, or direct spread from lung or any soft tissue TB infection. The most common affected bone اللي هم long bones and the vertebrae. Under the microscope, مثل ATB infection, it will show caseating granulomatous inflammation, caseation, that is destroying the bone, okay? Destroyed bone as well. طيب هلا what spots disease عبارة عن tuberculous spondylitis with vertebral TB, osteomyelitis. It will lead to destruction of the vertebrae. As a result, what we have malformation in the vertebral column. Kyphosis, اللي هو lateral curving of the backbone, and scoliosis. Okay? Scoliosis اللي هو الhump in the thoracic and cervical vertebra. Humping اللي هو الانحناء. Hunchback. Okay. Many complications. It may drain into psoas muscle, causing psoas abscess in the psoas muscle. طيب. هلا نيجي neoplastic lesions of the bone. Bone tumors could be secondary metastatic lesions or primary bone tumors. Metastatic tumors are more common than the primary ones. Diagnosis depends on clinical, radiologic, and pathologic correlation. جملة كتير مهمة اللي هو predilection of specific type. لما نفكر ب certain type of a tumor لازم ناخذ بعين الاعتبار age والanatomical site of that lesion. كثير بيعطي hints يعني can elevate the diagnosis, certain diagnosis to 90% لما بدنا نتوقع تيومر معين. يعني إذا أخذنا الage والanatomical site بتفرق بالdiagnosis، بيسهل علينا to reach the correct final diagnosis. Okay. We classify bone tumors according to the normal cell counterpart. يعني it's arising from osteocyte lesion or cartilage forming tumor or fibrous depositing tumor. Okay, depends on the normal cell counterpart. In general, also the benign tumors are much more common than the malignant ones. This table shows the different types of bone tumors. For example, chondrogenic tumor رح نحكي عن الاوستيوكوندروما, chondroma, and benign types, والmalignant ones اللي هم الchondrosarcomas. الاوستيوجينيك اللي هم البون فورمينج او osteoid deposited tumor osteogenic بنسميهم. المالجنانت اللي هو الاوستيوساركوما او البناين osteoid osteoma والاوستيوبلاستوما. طيب البون فورمينج tumors osteomas affected young age males site mostly involved اللي هم الفيمر or tibia around the knee joint. Also skull, facial bones, paranasal sinuses. Usually it is solitary, one lesion. If it is multiple, we suspect a hereditary syndrome, the Gardner syndrome, if we have multiple osteomas. Clinically, it may cause cosmetic deformity or obstruction in the sinuses, the kind of facial bones with paranasal sinus. It is a small bone outgrowth. Okay. طيب. Other two lesions راح نفرق بيناتهم لأنهم related to each other أو resemble each other under the microscope. They are similar. اللي هم الأوستيويد أوستيوما والأوستيوبلاستوما. السايت based on the site الأوستيويد أوستيوما affect the cortex of proximal femur and tibia اللي هم around the knee joint. الأوستيوبلاستوما vertebral bodies, okay? Cortex of the vertebra. Presentation clinically, osteoid osteoma presented with localized pain, nocturnal, comes at night, تمام? Relieved by aspirin or NSAIDs. هاي هي one of the characteristics للأوستيوid osteoma. If we compare it with osteoblastoma. Osteoblastoma, it is a dull pain, nocturnal, but not relieved by aspirin or the NSAIDs, okay? Histology بالhistology في عنا it's composed of a nidus يعني a core less than 2 cm الاوستيويد osteoma while the osteoblastoma more than 2 cm. Under the microscope we see what irregular woven bone surrounded by osteoclasts and vascularized connective tissue. هذا المنظر بنشوفه in both conditions. osteoid osteoma and osteoblastoma. لكن بيفرق انه الراديولوجي بيحكي لنا انه النايدس بالاوستيويد osteoma is less than 2 cm وبالاوستيوبلاستوما more than 2 cm. And it has the osteoid osteoma a thick rim of sclerotic bone. While in osteoblastoma it is thin. Okay? The sclerotic bone. Based on prognosis, it can recur after excision. It is rare to be associated with malignant transformation. Here is the nidus, okay, بتكون less than 2 cm in osteoid osteoma, while more than 2 cm in osteoblastoma. Under the microscope, we see sclerotic bone rim, thick one بالاوستيوبلاستوما, صح؟ بالاوستيويد osteoma, sorry, وthin بالاوستيوبلاستوما. And in the center we have a irregular trabecule of woven bone lined by osteoblast and vascularized connective tissue in between. Okay? طيب malignant bone forming tumor اللي هو الاوستيوساركوما. It has a bimodal age distribution in children and in adults. In children less than 20 years of age. The primary one in adults, most likely it is secondary in older adults, after 60, for example, associated with underlying bone conditions like what? Bone infarction, Paget disease, and history of a previous radiation. Site of involvement بالنسبة للبون اللي هو metaphysis of long bones, okay? Most common site اللي هو around the knee joint اللي هم knee joint, okay, الفيمر والtibia. Usually it is a solitary lesion and affecting the medullary bone more than the cortical bone at the metaphysis, okay? The genetic background of osteosarcoma in about to 70% of cases في عنا retinoblastoma gene mutation in sporadic cases or in inherited cases. Germline retinoblastoma خدناها بالpathology. Pathology hereditary retinoblastoma, they are at increased risk of developing osteosarcoma because of the RB gene mutation. Other mutations like p53, cyclin, dependent kinase, and cyclins. So clinically, it's painful enlarging mass. On X-ray, we call description large destructive lesion. It could be mixed lytic and plastic lesion, okay, and في sclerotic bone formation. وفي expression اللي هو radiologic phenomena called Codman triangle. Codman triangle اللي هو related to what? Elevation of the periosteum due to the extension of osteosarcoma to the adjacent soft tissue. بتصير elevation للperiosteum بيعطينا triangle seen with X-rays. بنسميه Codman triangle. Okay? Grossly here we have this metaphyseal bone lesion, osteosarcoma with extension into soft tissue and elevation of the periosteum forming the Codman triangle. Under the histology, under the microscope, we will see what? Malignant osteoplastic cells, بيكون فيها atypical osteoblast, producing the osteoid. This is pathognomonic of osteosarcoma, اللي هو osteoid deposition, اللي هي بتكون pinkish material deposited secreted by malignant osteoblast. فيهم atypical osteoblast. Pleomorphic cells وممكن نشوف كمان prominent mitosis as well. بس لو كانت low grade ممكن مثلا يكونوا rare mitosis ومش كثير واضحة البليومورفيزم. And 5-year survival can reach up to 70% if there is no metastasis at initial diagnosis. Primary osteosarcomas better than the secondary ones, اللي هم related to budget or radiation or infraction. It may spread to the lungs, where the treatment is treated with a multimodality approach. They start with neoadjuvant chemotherapy, see necrosis بالtumor, then surgery, excision, followed by another sessions of chemotherapy. هون الصورة picture you can see pleomorphic osteoblast with these cells and what deposition of this one osteoid. Okay, this is the osteoid. Now the cartilage forming tumors. رح نحكي عن الاوستيوكوندروما او اسمها الثاني اللي هي الاكسوستوسيس. Osteochondroma from the name فيها osteopart bony and chondrocartilaginous part. It usually has the shape of what? Mushroom like. نحكي لها mushroom lesion. بتكون في عنا cap, okay, ossifying cap, bony cap, cartilaginous cap and bony stalk. Okay, it affects the young age group, males more common. Sites metaphysis of long bones. It usually solitary in 85%. It could be multiple with the hereditary disease, hereditary exostosis syndrome. The presentation ممكن يكون incidental finding might be associated with pain. إذا صار في عندنا compression للnerve ممكن تعطي pain. Okay, and it might cause deformity if it is multiple. Okay, but grossly it's a bone stalk covered by cartilaginous cap attached to the underlying bone with a bony stalk, like this. Okay, mushroom-like with cartilaginous cap, bony stalk attaching to the underlying bone. وفيها bone marrow elements. تمام؟ cartilage, bone, and bone marrow elements. Most common sites حكينا metaphysis of long bone. طيب. السكند benign cartilaginous tumor اللي هو الكوندروما. هي only عبارة عن mature hyaline cartilage. It affects middle age metaphyses of peripheral small bones, okay, اللي هم الhands والfeet, الchondromas. Chondromas, it could be intramedullary, بنسميها inchondroma, أو on the bony surface, اسمهم juxtacortical chondromas. Juxta يعني adjacent to, صح؟ Juxtacortical, adjacent to the cortex. فهي بتكون على البوني surface. اسمهم juxtacortical chondromas. Usually it is solitary, multiple in hereditary conditions, اللي هم two conditions, Ollier disease ومافوتشي syndrome. مافوتشي syndrome بالإضافة للchondromas, multiple chondromas عندهم also brain gliomas. These are hereditary syndromic association with chondromas. Clinically, مثل osteochondroma, it could be incidental, not of the A symptoms, or it may be associated with pain or deformity if it is multiple. On X-ray will show what radiolucency with thin rim of dense bone around it, giving the O-ring sign. Okay, be radiology. Grossly, it's a translucent nodule because it's a cartilage. Okay, عبارة عن nodules of benign hyaline cartilage. It has a risk of what? Minor risk of transforming into chondrosarcoma, seen more with hereditary conditions, chondrosarcomas, to develop from chondroma. طيب هلا المالجنانت cartilage forming tumor اللي هو chondrosarcoma. chondrosarcoma ممكن تكون primary اللي هو ما في underlying cartilaginous condition، اوكي، or secondary للconditions اللي حكيناهم الاوستيوكوندروما او الchondromas. It affects the elderly patients, especially the conventional type. طبعا chondrosarcoma there are many types لإلها، لكن احنا اليوم رح نحكي او اللي بنحكي عنه الconventional اللي هو البروتوتايب تبعهم. في mesenchymal، في differentiated، في other types. فهو affecting the elderly patient. Which part of the skeleton? اللي هو axial skeleton. Okay, اللي هو pelvis والribs shoulders. شوف كيف إنه السايد مثلا في bony lesion أو lesion in the bone بيختلف أو بيعطينا hints والage بيعطينا hints عن الليجن اللي إحنا بنحكي عنه. إحنا بنحكي عن elderly axial skeleton مش مثل مثلا below 20 years with around the knee lesion. Okay. ما راح نفكر بالchondrosarcoma at that example. طيب, clinically progressively enlarging the painful mass. It is a large infiltrative mass destroying surrounding tissues, like a malignant tumor, most of the malignant tumors. Under the histology, we will see what? We'll see chondrocytes. These chondrocytes, إيش بيختلفوا كيف نختلفهم عن البناين؟ الهاي cellularity، اوكي، الاتيبيا اللي موجوده والميتوسيس. هذول 3 parameters نعتمد عليهم to differentiate البناين عن المالجنت. طبعا هذا الديفرنشيشن بيكون كثير critical when we are talking about low grade chondrosarcomas. لما نكون بالlow grades بيكون كثير decision صعب between is it benign or malignant. فلازم carefully to decide based on cellularity, atipia and mitosis. بالإضافة طبعاً للcorrelation مع الراديولوجي. الراديولوجي ده بيحكي لك if there's a lytic يعني destructive lesion, large lesion, الage، كل هدول العوامل بنحطهم مع بعض نقدر differentiate between benign and malignant lesions. Especially if كانوا low grade tumors. Treatment for chondrosarcoma is wide surgical excision. The prognosis it depends. حكينا في عنا different types, different grades chondrosarcoma. So it could be indolent into or aggressive lesions, depends on the type. Okay, size, grade, and stage and type. chondrosarcoma. Okay. مش عارفة ليش العناوين مش ظاهرة. This one احنا بنحكي عن giant cell tumor. Okay. The giant cell tumor affecting the adults الميلز more. هاي أول ليجن نحكي عنه affecting what الابيفيسيس of bone. تمام؟ insights بعطينا كمان hints للليجن اللي بنحكي عنها. The epiphysis of long bones. Usually it is solitary lesions. Presentation can be present with pain or incidental finding. On X-ray, it will show radiolucent lesion. بالhistology, from its name, it's germ cell tumor. أول إشي eye-catching feature اللي هو عبارة عن الجيرم سيل اللي هو multinucleated cells. بيكونوا sheets of multinucleated cells. In between, we have what osteoclast type giant cells اللي هم بيكونوا reactive. و in between في عنا mononuclear tumor cells هم actual tumor cells اللي هم mononuclear tumor cells. أوكي؟ اللي بيكونوا mononucleated هم الليجن ولكن بيعمل secretion the signals that induce the proliferation and activation of multinucleated giant cells. تمام؟ It is a benign course للgiant cell tumor, but it is a locally aggressive lesion. ممكن يعمل destruction للبون and it may recur. Recurrence is present. 4% might metastasize to lungs and regress continuously after metastasis to the lungs. Okay, this one اللي هي السيست صح؟ الانوريزمال بون cyst. Okay. Site of aneurysmal bone cyst اللي هو metaphysis. Benign cause, it may cause pain and swelling. On X-ray, it's a lytic lesion. Under the microscope, we will see what multiple filled cystic spaces filled with blood. There is no endothelial lining. Sometimes ممكن نستخدم certain immune stains to highlight there is no endothelial lining, okay, for these spaces. Separated by thin fibrous septi containing fibroblast, giant cells, osteoclast-like giant cells, and reactive woven bone in between these spaces. Okay? تمام. هلا هون نحكي عن الإيوينغ ساركوما. Ewing sarcoma, it's the second most common pediatric bony sarcoma. It's a malignant tumor of primitive round cells, blue small round cells with varying degrees of neuroectodermal differentiation. يكون فيها neural ectodermal differentiation and has a characteristic molecular signature اللي هو translocation 1122 with Ewing sarcoma. About 85% associated with this translocation. It affects younger age group, adolescents less than 20 years age. Site of Ewing sarcoma هم diaphysis of long bones, especially اللي هي femur. 20% of Ewing sarcoma we can see it outside the bone, the extraskeletal. ممكن تكون in any organ or any site, مش بس البون. Okay? 20% ممكن تكون extraskeletal. Clinically, it's large infiltrative mass destroying surrounding tissues. With X-ray, it shows osteolytic mass with onion skin periosteal reaction. Onion skin reaction. Okay, under the microscope we'll see sheets of small round blue cells. في تحت هذا الراوند blue cell tumors في تحتها many tumors بيجوا تحتهم نفس الديسكريبشن. One of them is Ewing sarcoma. تكون small cells round blue تكون النيوكليوس كبيرة مثل شكل الليمفوسايتس. Okay, shaped sheets of round uniform small cells. Characteristic histology كمان اللي هي الهومر-right rosettes. Rosettes بتكون malignant cells arranged in round in a circle around neural filaments at the center. تمام؟ لهيك بنسميه احنا neuroectodermal differentiation. Neuroectodermal differentiation. بيكونوا surrounding neural filaments. نسميهم Homer Wright rosettes. Characteristic for what? Ewing sarcoma. It has poor prognosis. Okay. طيب. هلا آخر شيء رح نحكي عن metastasis to bone. When we have multiple lesions, bony, destructive bony lytic lesions, usually it is more likely to be metastasis than a primary bone tumor. Common cancers to metastasize to bone, prostate, lung, breast, kidneys. In children, هدول بالadults, in children, neuroblastoma, Wilms tumor, and rhabdomyosarcoma. Sites involved by metastasis, usually the axial skeleton, vertebral column, pelvis, ribs, skull, and sternum. Okay.